All right, we'll jump right in since we have 30 minutes, and I think we're all a little bit nervous about how quickly that's going to go. But thank you so much for picking the session today. We really appreciate it. I'll let the ladies introduce themselves in a little bit more detail in a moment, but just wanted to say welcome to the session. I think we all know that employees are looking for a more personalized solution to benefits, and we're really trying to figure out how we can provide that while also making sure that we're able to control costs, right? We know that there's less money to spend and more need. So how do we make sure that we're managing that in the best way possible as we move forward? I'm really looking into what the insights are that Courtney and Joanna have in terms of what they are seeing and how they are addressing in the market, right? I would imagine that when we think about needing to look specifically at handling chronic conditions, handling the cost of specialty medications, this is something that many employers are dealing with today. And these two companies have really done a great job of determining how they can, again, continue to deliver a really great experience for their employees while also finding a way to make sure that they're controlling their costs as they are able to kind of work through the different benefits on a year-to-year basis. So I'm going to ask them to share any insights that they have and really just talk about how they are able to control any increasing spend and try to really look forward into the future in terms of what they will need to do in order to continue to control those increases as we move forward. So join me in welcoming Joanna and Courtney. I know he already gave a great introduction there, but if there's anything else you both would like to add, Joanna, I'll let you go first.
Sure. I think, National Church Residences, we are not a church. Although our name may imply, we are a senior living organization. We have two distinct business units. One is affordable housing and one is healthcare. So we have skilled nursing, assisted living, independent living, memory care properties, as well as about 350 affordable housing properties. We are in around 32 states, fluctuates occasionally. We have 2,300 employees currently with about 1,800 that are eligible for our plans.
I'm Courtney Mackes from First Triangle Bank. We are a Southeast regional bank in 12 states. We have just under 7,500 employees, around 12,000 covered lives on our health plan. We are growing constantly. We go through a lot of M&A activity in banking, so it's definitely changing, and we do a lot of work to try to meet our population's needs.
Perfect, thank you. So if you'll allow me a quick introduction to Quantum Health for those of you who don't know us, we are the leading navigation advocacy company, and we truly believe that nobody should have to navigate a healthcare journey alone. If you or anyone you loved have been through a difficult journey, you know how tough it can be to handle the claims, all of the appointments, all of the different billing situations that you might incur. So at Quantum, we are the single point of contact for members and providers, making sure that we're there to support members from a financial, clinical, holistic perspective, while also working closely with the providers to help remove any hurdles regarding authorizations, any of those other types of things that people often find issues with as they work through the healthcare system. So we're going to jump right in and just spend a little bit of time digging into what both of these companies are doing. So can you share a little bit, and Joanna, we'll start with you, on how your company expenditures have changed over time, what you've really done to focus in on the things that are important to you and make sure that the funds are being properly utilized in that way?
Sure. So we we went from fully insured to self-funded in 2020, just in time for COVID to hit. So clearly a very awkward year to start self-funding, which was a good year, but clearly not indicative of standard claims experience. We kept that in mind over time and locked in, and Quantum helped us to really quantify truly where we should be in a normal year. And so we kept that in mind as we went along, which really helped us to determine what were our actual costs. And while costs started rising, we started to really look, and Quantum was able to really give us a lot of information and data to help us understand our population. As you can imagine, we are serving seniors, and we have an aging population of employees as well. So our population average age is 42. where the normal is around 35. So we had to start looking at some different cost strategies for our folks. We're also caregivers. I know everybody heard Jennifer, hope I don't get that wrong, speak yesterday about caregivers. Our entire organization is caregivers. They work as caregivers, they're at home as caregivers. So we had to think about ways to help them to have a better work-life balance, as well as help, self-serve, right? To do things for themselves while they were at work.
Perfect. Thank you. Courtney.
Yeah, so we use a lot of data as well. Quantum's been very helpful in that. We look at our data to understand our population's needs, where they're at, right? We want to meet our population where they're at. We want to look and see where their needs really are versus where they think they are, because employees think they need some of these benefits, but when we look at where our disease populations are, where are our rising diseases, chronic conditions that we need to pay attention to. So we are a very big relier on our data. We are also using a lot of the social determinants of health data and targeting populations of our associates, so that we know in this market, these are the common issues that we see, and how can we help our associates. So utilizing a lot of data, understanding where our high costs are. So we get reporting that tells us, we've got these high cost claims coming in, or potential high costs, and that really helps us get our arms around where we're going, especially in the pharmacy world. That's our biggest increase this year has been our pharmacy spend is close to 50% of our total medical spend. So it's jumped. And I don't want to jump ahead because I know we're going to talk about that in a little bit, but yeah, it's a lot. So we're just trying to really wrap our hands around where are we spending the money, where do our associates need, and how do we keep them healthy?
So Courtney, we'll stay with you on that track then,
Okay.
right? But as we think about it, so then how did you adjust? What are some of the things that you did as you looked at what the needs were and what you were going to do to address them?
So we do a lot of well-being programming. So we've got a very robust program. It's branded Wellness First, and it's been around since the 80s. So we've been very focused on our employees' health for a very, very long time. So we do targeted programming through that with our challenges. We look at that information and say, okay, our associates are in need of education on where to go to get the best cost or the best care, or maybe it's the HSA. They don't understand how to use our HSAs or staying in network. So we funnel a lot of information through our wellness programming. And then we also incentivize our associates and their spouses to participate in challenges to earn money towards rewards and things like that. They can also get HSA money for doing their wellness exams. So we do a lot of incentivizing our population to participate in preventative screenings, with the anticipation that we'll catch things earlier and then keep the well, right, and address the sick who are sick.
And I know you mentioned kind of that growing specialty costs as well from a pharmacy perspective. Is that something that you guys are still looking at, or have you taken steps to start doing things differently there too?
Yeah, so we are looking at programming to help with our costs over there. So we're looking at some weight management programs. We do have the smart PAs in place to get those drugs covered appropriately, but we want to just make sure that we're additionally supporting our associates that need those medications, but try to rein in some of those costs as well.
I think everybody's there right now. So Joanna, obviously a very different type of population, right? When you think about your primary employees, but what are you all doing to address those trends?
So we, a lot of our trends, musculoskeletal, diabetes, hypertension, top 3 for us. And how do we get them to go to preventive screenings? I think someone mentioned yesterday that preventive screenings are really low for them. Same for us. So trying to encourage them. We also have some well-being programming. We take a holistic view at that well-being programming, offering various ways for them to earn incentives, as well as we've started offering Hinge Health this year to look at the musculoskeletal piece. We offer Omada. Omada helps with the diabetes and hypertension and obesity. And so we've really focused in on the chronic conditions because we feel that that's what's costing us the most. And also on our specialty meds and things, we're hoping to bring down some of the cost because of the chronic conditions. We know from the data that we have about 15% of our population that has 3 or more chronic conditions. So we need to reduce that number. And so we have added some point solutions. We're also looking at ways to conquer the specialty meds cost, which has also been an increase for us. So
Wonderful. So I'll stick with you for the next kind of round of questions. And I think when you think about navigation and what you hope to achieve, what do you feel like have been really the learning points that you've gotten from navigation? What do your people most appreciate? What does your team most appreciate about implementing a navigation vendor?
yeah, so Quantum has really helped our employees with finding the right services, finding the right providers. It has taken a ton off of my team. We went from probably 3 to 4 escalations a month to 1 to 2 a year. So the team at Quantum is really handling a lot of those issues. We aren't seeing people coming to us with, bills. I just don't know what to do with these bills. They don't make sense. They're helping them to get through those. We hear from our employees, the feedback is really just how much help that they received, and they felt like someone cared and asked us to continue with that benefit.
Perfect.
Yeah.
Courtney, what would you say for your organization?
Yeah, I would echo that it's taken a huge burden off of my team as well. We look at all of our vendors as an extension of us in HR in general, but there's definitely something special about the Quantum relationship. We do hear a lot of positive feedback of our associates that do engage with the programs. One story I heard recently, we had an associate whose husband had to get a lung transplant. And he unfortunately wound up passing away afterwards. However, the care coordinator sent her a card, a handwritten sympathy card, and she was just blown away at the service that she received through that program. So that is definitely an area we would expect to see that, right? That's what we want. And so that was a feel-good story that came out of a sad situation. But, our associates that reach out and need those EOBs explained, finding the locations, new diagnosis, where do we go? And so that having that line there has really been helpful for our associates.
Perfect. And perfect segue, of course, because we do talk a lot about the benefits to the clients, but I think when we think about the benefits to the employees too, and the importance there, a lot of it for us is building trust, right? We can't expect somebody to share all of their clinical concerns and everything else with us if we haven't built that trust. And I think at Quantum, we find that most people present to us with a financial need first, a financial question. And if we can help conquer that, help them through those steps, then it really does help people to start to develop that trust from more of a clinical perspective. So I think the fact that we can have that view of every vendor that you have in-house and everything that you're offering, that we're able to educate people at the right time in the right place on those ideas. So I always like to say that if somebody doesn't have diabetes at a certain time, when they read that benefit guide cover to cover, they're not going to remember they have Omada, right? But we're there to make sure that they remember at that point in time that there's something there to support them. So we put a couple of member quotes up, one from each of your companies, just to share a little bit about how I'll say, the people who are helping to serve on a day-to-day basis are able to support. And I think we're lucky we are just in Dublin, so our entire office is here. All of the folks that reach out to members and talk to members all sit here in the Columbus, Ohio area. So it's great to have everybody all in one place as well. As we think about closing, I would just ask you guys for any takeaways you have just for over the last couple of years with going to self-insured, right around COVID. That had to have been interesting. But when you think back on the last couple of years, what are the key takeaways? And then I'd also say, what are the things that you're looking towards in the future and kind of really thinking about and focusing on?
Sure. So, we're really looking, like I mentioned earlier, at the holistic employee. And so really trying to get them where they're at in their journey, whether that means that they are, just starting out as a nurse, and they're just trying to get their feet wet in nursing, and they don't yet have a family, they haven't yet purchased a house, but they might have some student loans. So we're looking at various things like student loan repayment options through the Secure Act. We've also gone as far as adding, pet insurance. This year, we added another organization called AirVet, which offers telemedicine for pets, because really they don't have time. They don't have time to take a pet to the vet, and then that becomes an emotional support issue, right? For those caregivers who are already emotionally taxed. We added family building benefits last year to assist with that aspect of life, and just trying to support from every angle, as well as then surveying our employees. So we try to survey them at least once a year to gain their insights and what they think that they need. We, of course, always add in the actual data. So, yeah.
Perfect. Thank you, Courtney.
Yeah, so similarly, we do a lot of surveys as well throughout our organization to understand, we want to hear from our people, right? And then we want to respond to that. So we really challenge all of our vendors to look at things differently, especially on the reporting side. Like I said, we're very data driven. So we utilize a lot of that information. We did an increase this year to our parental leave program to offer more paid time. I know that was a topic yesterday too. So we've increased our bereavement program. So now if a spouse or a child passes away, the associate gets 30 days paid bereavement under that program. So we do a lot of those evaluations every year to see what we're benchmarking against other organizations, other employers of choice, to see where our gaps are and where we can increase those benefit offerings to continue to be an employer of choice. And then, we meet our people where they're at. So, we get all this information, and then what do we do with it, right? So we take it back and we say, we heard you. This is what we've done. So that's meaningful to our associates.
That's wonderful. So any questions from the group on anything that we've talked about, or for either of these two companies in terms of what their approach is and what they're looking to accomplish?
Just a quick question on your benefit survey. Is this strictly for benefits, or are you incorporating it with your annual, touch point for HR as a whole?
Yeah, we actually have an employee benefits survey that is completely separate from our engagement survey.
We do too. We do an annual associate value survey, and there are benefit questions incorporated into that. And then after open enrollment every year, we do another touch point survey.
After open enrollment, that's interesting to kind of see how it went. I know that can always be an interesting time for people.